Assalamu alaikum. Good morning, everyone. Unfortunately, my partner couldn't be here today. He's traveling, so I'm in here for the last minute call. My name is Sanjida Afrin. I'm working as a program lead for volunteers opportunities. Our innovation's name is AMAR Health. I'll start introducing our innovation with a story. It's an imaginary story. Our beneficiary's name is Asma. Asma passed away back in 2021, right after COVID. She had cervical cancer. Asma was a sex worker. Even though prostitution is legal in Bangladesh, and we have like 11 brothels all across Bangladesh, out of which 140,000 sex workers are currently, the current population that's been documented in Bangladesh. I'm pretty sure the number is much more, but it's just the documented number. And numbers state that around 29,000 are underage girls. However, when we look at the data, when we try to look for data related to health services accessed by sex workers, there are none, like literally none. We looked up researches, the numbers are varied. They have statements about HIV data and STIs conducted, but none on services. They have health services that they have accessed. So it brings us to our problem, our area of concern here, which is sex workers in Bangladesh face significant barriers to accessing healthcare services, including a lack of awareness about available services and a fear of discrimination from healthcare providers. Why do they face these problems? Few of the key areas that we have identified is the lack of access to health services, a huge knowledge gap about SRHR issues, as well as available facilities to be accessed, fear of harassment, social stigma and discrimination, and financial constraints are there as well. However, we came up with a solution, which is AMAR Health. AMAR Health is a mobile app-based digital health card that will allow sex workers to have access to health services without having to go to healthcare providers physically. Through this app, they will not be facing they will not have the fear to face social stigmas and discrimination. This app will provide awareness and education related to sexual and reproductive health, and they will as well receive follow-up care through teleconsultation from doctors. So our user segment is, the direct beneficiaries are sex workers, indirect beneficiaries for this app are healthcare professionals, local government, community service providers and leaders, as well as youth and adolescents. So some of the key features of AMAR Health is going to be the app will support sex workers in accessing health and vaccine information. It will have regular health tips within the app, as well as contents related to SRHR activities, as well as have access to vending machine for sanitary pads. We initially thought it would be limited to access to vending machines for sanitary pads, but now we are thinking of also extending it to pharmaceutical services. So what the platform will look like, it will have a user interface which will include the registration in the initial phase, and after registration we'll have user profile after surveying the target group, right? It will have consultation, e-learning, e-pharmacy, and different other contents. So this is a brief journey. If Asma was alive today, she could have had with AMAR Health, where she could have called one of AMAR Health representatives who could have connected Asma to a doctor through teleconsultation. And this process would also include acquiring medicines through connection with pharmaceuticals through this app. The project mapping includes, we are targeting 4 major areas initially when we start the pilot. It's going to be a 6 months pilot in Dhaka, Khulna, Savar, and Faridpur, and we are targeting 1,000 sex workers, both floating and formal. The manual is going to be in Bangla with English subtitles. So our potential stakeholders are going to be Bangladesh Sex Workers Network and different community health care providers, as well as youth and adolescents and local government. If I summarize the journey to impact, there's a breakdown of from where we are starting from platform development to recruiting healthcare professionals who are going to give teleconsultation, as well as the community outreach through campaigns that we are going to conduct within a time period of 6 months. So how we plan to keep this model sustainable is that through the e-pharmacy, we are going to generate revenue as well as through e-learning. We have a budget breakdown here. I think my time's up. Yeah, thank you. If anyone has questions.